Hey everybody, it's Matt Shu from Upright Health, and today I'm here with Kristen, and we are kicking off a video series geared towards medical professionals. So we have clients here who are OTs, PTs, doctors, and we have a lot of regular clients who are their patients. And what we hear a lot of is that there's not a lot of training available for medical professionals to know what to look for in movements that are useful and necessary in daily life. So we've put together a lot of short videos here so that you can see very quickly and easily what you're looking for in terms of daily movement patterns and posture. And also we've included a couple quick suggestions that you could use with your patients to help them move better and feel better. So today we're starting off with just basic standing posture. And what we're going to do is look at what it means to stand up straight, and then where most people fail, and a quick exercise to help address that. So Kristen, I'm just going to have you stand right here. So you can see from the side view, when you look at Kristen, in general she's got pretty good posture. There are a couple of major faults that people end up usually having. So Kristen, can you show us thoracic kyphosis? So thoracic kyphosis is when the thoracic spine goes into that rounded position. And that's often accompanied by the rounding forward of the shoulders, also known as scapular protraction. So you can see, I'm giving you the back view. If I go like this, I've got my shoulder blades protracted and my spine, my thoracic spine in kyphosis. Let's go ahead and reset back to a neutral position. Then we also see lumbar lordosis. So lumbar lordosis, lordosis basically just means that there's a curve going in this direction. When it's hyperlordosis is when we need to be concerned, is when we start seeing like a really strong curve here. It's impossible to measure exactly where it's supposed to be, but it's a clue if you see somebody who's got really strong lordosis that maybe something about the severity of that lordosis may be causing some trouble for your patient. So go ahead and reset. Now, the one that most people have the biggest problem with is that thoracic kyphosis, because that also shows up a lot of times when you are in hyperlordosis, or whether you just have your shoulder blades protracted. So what we're going to do is show you one simple exercise that actually helps address that spinal neutral position, so that even if they have lordosis or they have kyphosis up in the mid-back, you have something that they can do to help correct that. So this is a super simple exercise. So Kristen's just going to come sit on the floor against the wall, and she's just going to put her butt up against the wall, and she's going to put her lower back into the wall as well. Then she's got her entire spine up against the wall, and then she's pulling her head and neck back to touch the wall. Okay, so basically what she's doing is she is pushing everything flat into the wall, and then the wall is giving her a template where she can then keep the spine straight, and then she pulls her head and neck back, so that's all in one straight line. So if she's normally in this kyphosis position, then the wall is helping her learn to use the right muscles to help pull up like this and maintain that good position. If she's in lordosis, she's also learning, boom, get that lower back a little bit flatter, and then again get the thoracic spine a little bit straighter. So that's a real simple exercise that you can use. So hope that helps you, and please remember that pain sucks.
Life shouldn't.
To get scapular retraction, a lot of people will start to use their spinal erectors, especially